Good afternoon. This is Mayor Bob Byrnes, Mayor of the City of Marshall. Today it's about 1 o'clock in the afternoon and it is on May 4th, 2020. So we're here to share some information on the current emergency situation that we continue to be in related to the COVID-19. We'll share a bit of city information. Dr. Steve Meister will share a bit about the current medical situation, and then I'll come back and talk about some things that are open, some things that remain closed until further notice, and some things that are open. So at this point, our city declared emergency has been extended by the Marshall City Council until May 26. What this means is that during this time, it allows us to really focus on what we need to do in preparation for more emergency situations down the road. On the other hand, we do know at this point that there's been a lot of things that have been done, so it's really more of a continuation of what we have been doing for the past number of weeks. Our testing positive results for this county are at 9. That's really tells us a couple things, and Dr. Meister will talk a bit more about testing, but that tells us a couple of things. One is the community has really been doing a good job in terms of self-isolation, social distancing to limit the spread of the virus. It may also tell us that something about limitations on the amount of testing that is available in this area, and that's really what Dr. Meister will talk about today.
Sure. Thank you, Bob. So, the testing question comes up often, and we ask who gets tested, why get tested, when get tested. Really, ideally for this disease and for any disease would be that everybody who wants to get tested could get tested. That is just not practical for a couple of reasons. Number one, the testing supplies are very limited. We're getting more of them. Supplies are increasing as the manufacturers are ramping up and getting their supplies up. And so supplies for testing are becoming a little bit more available. However, we are still limiting testing to those who are at highest risk. And those at highest risk, we ascertain and determine who those are based on 3 sources of truth. And those 3 sources of truth are the Centers for Disease Control, Minnesota Department of Health, and then our Avera system as a whole. And we have a kind of a bridge or a guideline, it'll be on the screen, of what those are. But the highest risk people are those who are in the hospital, sick with COVID-like symptoms, healthcare workers, obviously, who are showing symptoms, congregate living, meaning those who live in long-term care facilities, nursing homes, who have symptoms, and people such as that, or people who have been related to people who have symptoms, i.e. your spouse or family member who you're in close contact with ends up in the hospital with COVID documented, you'll get tested as well, especially if you show symptoms. Now, remember the limitations of the testing. These tests, unfortunately, are only 70% sensitive, and that's the best test. What does that mean? That means that there's a 30% false negative rate. A sensitive test is used to figure out who actually has the disease. You want an ideal test to be 100% sensitive, meaning if the test is negative, you don't have the disease. In this particular case, 30% of these tests are false negatives, meaning you may have the disease and it's just negative. So again, we don't recommend just running out and getting the test yet because of these limitations. But if you have the symptoms, call 188-AVERA and explain the symptoms, and they'll guide you to whether or not you should be tested for it. And if you're tested, if you're asymptomatic, go back home because this is a viral illness. And right now, it's just like a common cold. You sit back, have some chicken soup, social isolate, and stay away from people, cover your cough, wipe down, use your good hand washing techniques, and you should be fine. However, if your symptoms get worse, let us know, come to the doctor, and let us know that you're concerned and that you were tested. That would expedite things, and then we can treat you appropriately.
Thank you, Steve. Let me just finish with a number of things. We are continuing to have a lot of input from our business community. We encourage people to continue to support our local businesses, many of which are are operating under a limited basis. Most of them are providing some curbside services, which is now allowed. We do anticipate that there'll be some easing up on some of those restrictions as we go into the next couple of weeks or so. We are in contact with the governor's office. We are in contact with our local legislators, and we are sharing the concerns that we're hearing from our business community about the impact this is having on their livelihood and their business. We have made some changes, obviously, to some city operations, focusing on essential services, those services that we absolutely need to have continuation of, that being public safety, public works. We are continuing our street improvement projects, and of course, water and wastewater is essential. We have some services that we cannot be continued. For example, some community services classes that have been canceled. We will not be having the city band this summer because of health concerns on the close proximity and transmission of the aerosol, which could carry the virus and that type of thing. So the summer band will be canceled. Over the next couple of weeks, we'll be making some additional decisions based on input from the governor's office, as well as our medical experts on other summer programs like summer youth programs, as well as the aquatic center. So more to come. Both Steve and I will try to share information on a timely basis as it becomes available. But again, if people have questions, city questions, contact the city. Medical questions, contact Avera, and know that there's a lot of people working on this, and we're fortunate that we have the emergency and medical professionals that have really a good plan or are implementing that plan as we speak. This is Bob Byrnes, Mayor of the City of Marshall.
And Bob, thank you very much for your input, but I can't let you go without one more thing. Today is May the 4th, which is Star Wars Day, so May the 4th be with you.